Do countries taking in Ukrainian refugees have the ability to address their medical needs? That's what Paul Spiegel, the World Health Organization's emergency coordinator for the Ukrainian refugee response, wanted to find out on his nearly 7-week deployment to cities in the Czech Republic, Poland, Romania and Slovakia where many Ukrainian refugees are currently residing. More than 5 million people have left Ukraine since the war started, with numbers rising every day, according to UNHCR, the UN refugee agency. The answer, he found, is mostly positive. Based on his observations and his many conversations with refugees, health and government officials and charities, Spiegel believes that healthcare facilities in the cities he visited are able to take care of most of the situation right now. That is, at the moment there is enough capacity to take. Spiegel, the director of the Center for Humanitarian Health at Johns Hopkins University, returned to the U.S. in late April. He spoke to NPR about the medical needs of refugees and how this crisis compares to others around the world. This interview has been edited for length and clarity. Ukrainian refugees are composed mostly of women and children because most men ages 18 to 60 have been banned from leaving the country. How are these refugees being greeted in these border areas? The refugee-hosting European Union countries are extraordinarily welcoming to Ukrainian refugees. This is a model response. Instead of staying in refugee camps, most of the refugees from Ukraine are staying with host families all over Europe or in hotels and dormitories for free. Governments are allowing them to work legally and are also providing many of the same health services as provided to national populations. That is extremely generous. There is a generosity and openness that I wish could be applied to anyone fleeing conflict and needing support, wherever they are coming from. Is the welcome that refugees from Ukraine receive in European countries different from past refugee experiences? In Europe, the migrants and refugees from Syria and countries in Africa were treated very differently. Walls and barriers were constructed to keep them out. However, many are fleeing violence and war and they have the right to asylum. Ethiopia has welcomed hundreds of thousands of refugees from Somalia and other countries, but they are often put in camps and not allowed to work, and they rely on the UN and international NGOs, non-governmental organizations, to set up education and healthcare programs for refugees. And for Syrian refugees in surrounding host countries, access to healthcare varied according to country. What are the most urgent medical needs for the refugees from Ukraine?